FACE program has 4 pillars. We have our healthcare professionals, our local hospitals, technology, and community education. So we need all 4 pillars to work together to have a successful program. So what is a facilitator? This is just kind of a generic definition of what a facilitator is. An individual who enables groups and organizations to work more effectively, to collaborate and achieve synergy, or one that helps to bring about an outcome, as learning, productivity, or communication. So as far as the Arkansas SAFE's facilitator role, community stroke education is essential for an effective telestroke program. Dedicated stroke education planning and development. We ask to dedicate 2 to 3 weeks approximately to the community education and to work on it, come up with ideas, do some brainstorming on what you can do to have those 2 community outreach events. Utilize events, programs, resources that are already established in your community and hospital. There are so many things out there in your communities that you may not be aware of, or you may not think about working within, partnering with them. There's so many the physicians' offices you can work with. There's AHECs, there's the health departments, there's Hometown Health Improvement Coalition. So there's so much out there that you may not be aware of. So if you ever have any questions about that, please ask with me. And then facilitate community stroke education. Again, the goal of at least 2 events per month. And you're going to act as a catalyst for your community stroke education. Again, involve others in your community. Involve others in the hospital. You don't have to do it by yourself. Encourage and engage others to participate and build on your past successes. If you've already had an event that you've done and it went well, you can do it again later, or you can share those ideas with some of the other facilitators, and which is something we're going to do here in a little bit, so that they can have some of those ideas as well to hopefully have in their community. And document through pictures and videos. We like to see newspaper clips. We like to see pictures, videos, anything that you have out there. We'd love for you to share with us, and then in turn we can share with others. So why bother? Decrease time from the onset of symptoms to activation of EMS. We hear how important it is not only to know the signs and symptoms, but the importance of calling 911 immediately. And we want to stress that over and over in the community. That and knowing the signs and symptoms. Also, the community education is another way to help promote your facility. Okay, Rick's going to talk a little bit about the 2 of us and our roles.
You know, one of the most incredible things that you can do as a facilitator or a nurse is give somebody back their health. And one of the things that I've seen over and over again from facilitators is that when they see it happen, when that person gets TPA and walks out of the hospital, it is the most incredible feeling you ever have. And so this is what it's really all about those patients. Laura and I are here to support you in that role, to give you educational materials, anything that we can do. We need you to contact us though. Tell us what you need, and we will be your resources, and we will try to get those done as quickly as possible for you. Use technology. Use things like Twitter. We have a Twitter account. Twitter to one another. If you're a Twitterer or tweeter, get on and let's tweet together, okay? And there's...
I was just going to say, if anybody wants to follow us, we're AR Saves on Twitter.
Okay. It's kind of fun.
It is. I'm still learning.
And there's lots of ways, there's lots of information you can put on there and lots of updates and share together. Look for opportunities in your community that are already established, like your community events, group events, any type of safety or health fairs, any type of activities like 5K runs or banquets or local festivals, all that. All those are available to you right there in your community, and you can just tap into what's already available. Involve the schools. Use your MASH students that a lot of times are being educated in your hospital already during the summer. Is a great time to involve them. And East Lab students, some of the most incredible work we've seen for community outreach has been through East Lab students like at Lamar that actually educated over 10,000 people in a community, from all the way from the kindergarten kids all the way up into the adults in that community. Health classes. Look for ways to involve maybe your baseball teams, your local Little League teams. It could be a strikeout stroke event as well. Again, we're trying to get you to envision having at least 2 community events a month, but that means that you're going to be the facilitator of that. Not necessarily that you're doing them all, but you are enabling them to have the materials and the resources available to make that event possible. It can be simple or complicated, but it's what works for you in your facility. The 2 types that we talk about is there's active types where you are physically there and actively a part of that, or somebody in your facility. It could be nursing students, it could be lots of people, but they may be actually doing a presentation. The other type is the passive type, which is like posters on walls at your local library or your waiting rooms. And if you've ever seen somebody in an ER, if they're there very long, they will read everything in that ER. So what a great place to put educational materials and brochures and stuff like that you could educate people passively. And everybody talks about potty talk. But if you're in a stall, you're not going to read. You're going to read everything that's available, right? So that's an opportunity, and a lot of people utilize an area like that. Physician kits. A lot of you used those last year. Those physician kits were very successful. You took them out there into that local community, you put them in the clinics, engaged those office managers to keep that material out and educate those populations that are high risk. If they've got all those risk factors, they need to be educated, because you really don't want them to have a stroke. You want them to prevent that stroke. So that's an opportunity. So look for those types of things. You've got lots of resources. You've got Lauren and myself as health educators, but you've got your local health departments and all those local folks that are already educating. Tap into them. Say, take some of our materials, engage them. Outreach nurses. You've got 3 that are part of this state. They will come, they'll do EMS trainings, they do all kinds of different things that can engage your community. Engage your IT support. They're part of this program too. Tap into links to websites or educational information. You can embed videos. It could be all kinds of opportunities there. Remember that we have educational materials free to you, and we tap into other resources like the NIH as well as Genentech's materials. And don't forget the Twitter accounts as well as our own website, which has lots of links on it. There are also on your flash drives. All these presentations are on there. There are tons of video there. There's all kinds of no stroke in the community. There's even animations for children. The hip hop campaign, if you've ever seen that, or for kids. It's all on there, readily available. So you've got a toolkit in this right here with hundreds and hundreds of ideas, all available to you. Don't forget about your organizations like American Heart and Stroke, as well as the National Stroke Association too. One of the things that we want to really encourage you to do is to re-engage those 310 stroke champions that we trained on that day at 25 different sites around the state. Many of you I see in the room had participants, but that doesn't mean that you can't have your own stroke champions and educate those folks. On your tables you have a little mini kit that is designed for those stroke champions. And it's got just about anything and everything from presentations to outreach materials that you could hand off to them and say, go get them. Educate your church, your civic organization, your sorority, your fraternity, whatever it takes. Re-engage those folks is really what we're trying to do here. On your flash drives, we have all this information that Matt had on how to contact the NIH and all that, Genentech as well, and it has all 310 stroke champions already on there. If you don't have the list any longer, you have it. Re-engage those folks. Now we're going to try to do 3 things. Somebody said we couldn't do it, but we're going to do it anyway. All right, we're going to do an activity now. On your table, you have a little sheet. It has your name and all that. Very, very quickly, you're going to write down some activities that are very creative that you've done for community outreach stroke education. And then what we're going to do is we're going to flip you around and put you in groups, and you're going to share with that group what you've done. And I hope before you leave here in the next 10 minutes, you're going to have 2 more new ideas, okay? And so I'm going to put you all in groups. All right, if y'all will just slide right back here with this group. Okay, we're running out of time. I know that's quick, and that's fast, and that's furious. But it shows you what you can do in 5 minutes. 5 minutes of brainstorming with other people. There was probably all kinds of ideas flowing in this room. And we want to make sure that everybody gets an opportunity to see what you come up with. So don't leave with your sheets. Our sheets we're going to collect. We're going to compile them, and we will email you everybody's idea. So all of a sudden you just got 100 new ideas in this activity in 5 minutes. Okay, what do we take away today? Well, you got this toolkit on that flash drive, right? Everybody got one at the conference. You've got videos. You've got all kinds of resources on that one little flash drive. Don't lose it. It's real powerful. You've got community kits that you can share with a stroke champion in your community. Remember, plan, plan, plan. Utilize the things that are already in place. Plan your monthly activities. Do passive or active, and you'll be surprised. You'll be doing lots more than you think. Now, collaborate with others surrounding hospitals, each other. The best ideas are from people that have been in your shoes, like Janie Evans up in a little town of Batesville. She did all kinds of great things. She took the Strikeout Stroke thing. She won all kinds of ribbons with this at the county fair. She had kids affairs and got the kids to put their handprints on all this, and then she ran all those videos from Hip Hop Stroke, and then she said that hundreds of them would just come by and dance and watch the videos and learn to recognize a stroke. What a great idea. Use those opportunities. Now, there's other folks in your areas like Bridget Bondio that's done Go Red and utilize that as a forum. Aaron Fuller, a new facilitator, went into a new little bitty school and educated every child from K through 12 on the Act Fast. How powerful is that for that little community? And then Christy Fouts came up with this great idea of having a video it's a commercial that runs at the new Paragould movie theater before every movie. How powerful is that? Cool ideas that are very, very effective. The summary here. Community education is essential to the success of your program. We can predict statistically that if you do not do community outreach, it will go up, it will plateau, and it will regress. That's what's going to happen because people won't come in. All the training, all the equipment, all the passion you have will go untapped unless those folks call 911. That's the key. And by you talking to them, When you're talking to a group, 1 in 4 Arkansans is going to have a family member have a stroke. 1 in 7 is going to experience it. So every time you talk to a group, you may be talking to the person that is going to have to make the decision that could literally save their life or their quality of life. Now, resources are available. We're here. We will get you materials, whatever you need. Think about your community education plan. And remember, in Arkansas, before this program started in November of 2008, you had a less than 1% chance of receiving TPA in this state, even if you got there in time. That's a tragedy. Where we've changed that statistic significantly by you being there and being part of this program. We're now running at 23%, which is outstanding. But what about those other 70%? What if it was your family member? You would want them there in time. And community education is vital to make that happen.